Topic of the day, Mask Up Phoenix. Hello, I'm Eric Moreno, and welcome to another Phoenix TV Virtual Report. For some, wearing a mask is still a bit confusing during this worldwide pandemic. Joining me today is Dr. Rebecca Sunenshine, Medical Director for Disease Control at Maricopa County and a captain in the U.S. Public Health Service. Dr. Sunenshine, welcome and thank you for being here with us.
Thank you for having me.
I'd like to summarize a little bit of your career. I understand you have 22 years of experience in the medical field. You've also served at the Arizona Department of Health Services for 4 years. You've been with Maricopa County Public Health since 2010 and also have been CDC Career Epidemiology Field Officer to Arizona since 2006. Is that correct?
That's correct. Yeah.
Wow, doctor, we're very lucky to have you here in the county. Anything you'd like to highlight over this 22-year span of your career?
Well, I think something that is really standing out for me and for everybody who is practicing local and state level public health is that this is a different experience than anything else I've ever seen. I'm trained in infectious diseases and I've been doing infectious disease epidemiology for a long time, but there are so many other factors at play in this pandemic, with all different levels of government getting involved and a lot of media and emphasis on what's happening around the world. And I think there's just a lot of information to take in. And sometimes what people really need is someone to just say, okay, what's the most important take home message here? And that's really what my goal is, to try to help people understand, what do I really need to walk away with.
So Maricopa County issued the order to all residents over the age of 2 to wear face coverings. Can you tell us a little bit more about that?
Yes. Well, what we know about cloth face coverings is that they actually are effective at keeping germs, particularly the COVID-19 virus, inside somebody's mouth and nose, and they keep them from spreading to other people. And that's so important because this is a disease where we now know that probably about 40% of people who have the disease, who are infected with it, don't have any symptoms at all. And we know that they can spread the disease. So we know that these masks are effective at keeping the germs inside from someone. But in the last month or so, we got a lot more data that shows that masks, when they fit well and they're made of the right materials with enough layers, they can actually protect the person wearing the mask from getting infected by other people. And that's something that's really new information. And what's been going around in the literature is that we believe that masks are about 60% effective at preventing you from getting infected by someone else when they are within 6 feet of you. So what masks do is they serve as a backup. If you cannot maintain 6 feet of distance, a mask is pretty effective at preventing the spread of disease. But I want people to understand that a mask is not a substitute for staying 6 feet away. So the reason why there is a mask requirement in Maricopa County is because it's not always possible to maintain those 6 feet. And we want people to wear a mask so they have the best chance of being protected if somehow that 6 feet is not maintained. We've always had very good data that surgical masks and N95 respirators, so medical grade masks, work really well to protect both the wearer and to keep germs from spreading to other people. But before this started, there really wasn't a lot of good data telling us that cloth masks would provide a level of protection. And that's what was missing. And for any of you who have worn a mask, and I am absolutely the worst mask toucher in the world. When you're wearing a mask, it is really difficult not to constantly want to touch the mask and touch your face. So there were concerns that wearing that mask would cause you to touch your face more. And we know the mask is contaminated, it's dirty when it's on your face. and we were worried that it might spread things. But what we know now is that if you can get a majority of the population, up to 80% of people wearing a mask, that you can actually stop the spread of COVID-19 in your community. And that new information has changed all of the public health community to now say we have to require masks to be worn for people who can wear them, and not everybody can.
Again, washing hands, trying to use hand sanitizer along with wearing the mask is basically the best combination, right?
Exactly. So wearing the first thing, most important, try to maintain 6 feet of distance from everyone. If you can't do that, we ask that you're wearing a mask even when you think you can, because you never know when someone is just going to come within your space. Washing your hands, avoiding touching your mouth and nose, and then using hand sanitizer. And hand sanitizer has taken on a whole new role in my life. I literally have it strapped to my purse because as I mentioned before, I can't help readjusting my mask. So now when I readjust my mask, I just sanitize my hands every time. And the one thing that I want to clarify, I think a lot of people think, oh, I need to sanitize my hands before I touch my mask. That's not necessary. Once your mask goes on your face, it's considered dirty or contaminated. The inside is contaminated with your germs, and the outside is contaminated with everyone else's germs. So you really want to make sure that it's after you touch your mask, then you sanitize your hands so you don't spread those germs to other people and back to yourself.
And it's great to see that City of Phoenix leadership, along with the county, are working hand in hand to help get the message out. Phoenix Mayor Kate Gallego, along with the City Council, issued the declaration requiring residents to cover their nose and mouth whenever they're away from their home and unable to physically distance.
Mhm.
Some of the key points of this regulation apply to everyone over the age of 2. Um, Adults with children 2 to 5 years old must make a reasonable effort to make them wear masks inside enclosed public spaces. And all riders and operators on public transportation must wear a mask. And staff working in public spaces such as restaurants or stores must also wear masks. Are there any other key points that you'd like to mention?
First, I want to say how grateful we are to the city of Phoenix for really setting the stage and putting out that mask requirement. It's so important that everybody is on board and working together. Wearing a mask is a community effort. It doesn't just protect you, it protects others around you. So Maricopa County's goal in requiring mask wear was to make sure that there was a minimum set of requirements for all the cities, and that if cities wanted to do something stricter, they could. All of the things that you stated for the City of Phoenix mask requirement basically apply in Maricopa County. I'll just give a couple more highlights. So children under 2 do not have to wear a mask, but also anybody with a medical condition where they have difficulty breathing, for instance, if someone is on oxygen, we don't recommend that they wear a mask. And then anybody who is unable to remove the mask themselves, we don't want them to wear a mask either. It, just to clarify, the masks are not required to be worn in your home or even outside your home on your own property. We do ask that the public wear masks while they're in a restaurant, but they can remove them obviously once they sit at the table and they're eating or drinking. But we ask that if you get up from the table and you're going to the restroom, please put that mask back on because you are again indoors. The other thing that was not clear initially but was amended in the order is that if people are exercising, they don't have to wear a mask. Wearing a mask is completely safe. It does not deprive someone of oxygen, and it certainly does not cause carbon dioxide poisoning. There are plenty of gaps and ways for air to get in and out of a mask. But if you're exercising while you wear a mask, it can feel harder to breathe. So they do allow for people to not wear a mask while they're exercising outdoors. And then as long as you maintain 6 feet in another setting, you don't have to wear one.
Great. Now, some important exemptions from wearing masks. This doesn't, like you said, this doesn't apply to people inside their homes. Obviously, children under the age of 2, restaurant patrons while they're eating and drinking, and again, recapping people walking or exercising outdoors as long as they're maintaining the 6 feet of distance or in a personal vehicle, office, or personal space.
Right.
Did I miss any important exemptions that maybe you'd like to cover?
No, I think that's everything. The one thing that I will highlight is that children between the age of 2 and 5, we know it can be challenging to keep a mask on them. And we
Hmm.
have gotten questions from childcare facilities with those younger children. It says make a reasonable effort to keep the mask on. We don't want childcare facilities to spend all day trying to keep masks on these young children. So we understand that children aged 2 to 5 may just simply not keep the mask on, but we ask that adults make a reasonable effort.
Now, before we finish, I'd like to ask, what would you consider some of the best examples of face coverings or masks that are practical and something that people wouldn't have a hard time finding?
Well, there's a couple things. The most important thing about a face covering is that it fits well without any big gaps around the face. So if there's big gaps, you want to avoid that. Now you can actually get a pretty tight fit with a bandana, or you can even make one out of a t-shirt. And there's a great video by the Surgeon General of making a mask out of a t-shirt. The other things we know make masks more effective are having multiple layers of material, and research shows that having a blend of materials tends to be better than having just cotton alone. But I think the most important thing is having multiple layers and not a lot of gaps so that germs can't get into those gaps or out of those gaps and escape to other people.
Dr. Sunenshine, there are some residents who believe that if they've already contracted COVID-19 and recovered fully, they don't need to wear masks. Can you talk a little bit more about that scenario?
What I would say about that is we are still learning so much about this disease. We are fairly confident that people don't shed virus after a certain period of time, but we don't really know everything. So if you already had it, is there a chance you might be able to infect someone else? Maybe. So we ask that you wear that mask anyway so that you don't infect anyone else. And the other thing we're not sure about is, can you get it again? The data are showing us that you probably cannot get reinfected, at least for a few months, but we still don't know everything. So we ask that everyone in the community wear a mask so that other people in the community feel safe and that we can limit the spread. And if enough people in the community wear a mask, we can actually decrease the spread enough in our community that we may actually be able to completely get it under control before we get a vaccine. And wearing a mask is really our best chance of that.
Great. Anything else you'd like to add?
No, I think that's all. I really appreciate the opportunity.
Thank you for joining us and helping us understand best practices and setting the record straight with some of these misconceptions.
All right, thank you.
Thank you again, Dr. Sunenshine. We really appreciate your time. Again, this report is purely for educational purposes and to help encourage residents to stay safe. For Phoenix TV Virtual Reporting, I'm Eric Moreno.